Now, when it comes to accidents, prevention is far better than a cure, and the Royal Flying Doctors Service is claiming that a bit more prevention could save the nation's hospitals up to $1 billion.
It's found that rural and remote Australians are twice as likely to suffer injury than those in our major cities. Martin Laverty, the CEO of the Royal Flying Doctors, joins us now from Canberra. Martin, good morning. Good to talk to you. So what have you discovered about the health of Australians in rural, regional and remote locations?
Well, very sadly, if you live in country Australia, you're twice as likely to suffer an avoidable accident than if you live in the city. When it comes to motor vehicle accidents, you're 4 times more likely to die in a motor vehicle accident in remote parts of Australia. Each year, there's 1.8 million admissions to emergency departments for accidents and injury. That's costing the taxpayers $1 billion. Our research released today is suggesting that if we take better action to prevent accidents from occurring, we can not only save taxpayer dollars, but we can save people's lives.
Isn't one element of this simply circumstance, the unfortunate aspect that if you are in those locations, you have to drive longer distances across poorer roads, often just using the car accident example for a moment, if I can, with roads that don't have lighting that we enjoy in the cities. Can that ever really be changed?
Well, yes. 30 years ago, there were 3 times more people killed on our roads than there were this year. For example, in 1986, there were 18 people killed for every 100,000 people in the community. This year, it looks like there's only going to be 5. That's a 2/3 reduction. We've been able to reduce deaths in motor vehicle accidents through 3 factors. The first, today we are driving safer cars. We've got better technology such as airbags and the use of seatbelts. Secondly, we are seeing improvements in roads. There's been billions of dollars spent on making our roads safer. Not all of that has been spent in the right places in country Australia to date. And third, we've seen improvement in driver behaviour encouraged by better policing and oversight of alcohol, of speeding and drug use. This shows that if in 30 years we've been able to reduce motor vehicle accident deaths by 2/3, prevention works. And our research today from the Flying Doctors is saying we need more investment in preventing accidents and injuries from occurring to not only improve people's lives, but save unavoidable admissions to hospital.
Martin Laverty, where else are the investment areas that you think might make a difference? I notice here that you've got assault deaths are higher, more likely in those areas than in the cities. Poisoning as well, workplace injury. So where specifically would the investments go?
Well, across just about every indicator, if you live in a remote part of Australia, you're more at risk of an injury than if you live in the city. And let's just look at children for a moment. 1 in 3 child hospitalisations each year is for an accident or an injury. It's not widely known that accidents and injuries claim more children's lives in Australia each year than cancer and nervous system illnesses combined. So if we're to target our investments and energies, we have to work right across the entire Australian community, but recognise a child in a country area is at twice the risk of an avoidable accident and injury than a child in the city. So our energies need to be directed to country and remote Australia. Some 10 years ago, in 2004, 12 years ago in fact, a 10-year National Injury and Prevention Plan was adopted by the Council of Australian Governments. That plan expired in 2014. That's 2 years ago. There hasn't been a new plan or new energies invested. Today we're saying to the Council of Australian Governments, reenact that plan because prevention has proven to work. And if we want to save more lives and more taxpayers' dollars, it's time to get on with it.
Martin Laverty, we'll leave it there, but thanks for joining us this morning. It's an interesting report.
Thanks for your interest, Virginia.